cancers are of unknown causes, yes, but in the case of breast cancer, which is one of the most stubborn of all the cancers in the world, it's highly devastating for the women folk, and it comes in with all kinds of issues, hormonal imbalance, a lot of pains, a lot of issues of tumor swellings at the breast, which can spread to the lungs and to many other areas. But the good news is that with phytomedicine, breast cancer can be handled headlong. And with doing this, we use a number of products. For our Nigerian viewers, the plan that is called Hospital Too Far, and with other blood-giving products, go a long way in trying to calm the pain of cancer of the breast. With apricot, which I mentioned earlier for prostate, is also in view here. Cassava, which contains vitamin B17, which I have been able to test in my lab, have a great future for the cancer of the breast. But for the proper combination, tomatoes, soya beans, and a number of them come in handy here because of their composition, because of their capacity when they are properly combined to balance the hormonal imbalance that is at the center can be easily taken care of. And before you know, the cancer bows and begins to calm down. Then the swellings begins to soften. Cancer never softens, but when it's dealt with phytomedicine, the swollen area begins to mellow down, begins to soften. And patients come and say, pharmacist, I noticed that it's not as hard as before. I say, yes, that is what phytomedicine can do. But the issue is that for the breast cancer, it has to be a number of phytomedicines, quite a number of them, and it has to be used for a very, very long time. And the cancer can even pretend to go and still come back. And in most cases, when this cancer is being treated, the husband should be able to give and take some medication along, because some viruses are implicated. And during the man meeting with his wife, some of these things are transmitted and they tend to come back. It happens in the case of prostate, and it also can happen in the case of breast cancer. So there's a need, since these things are not chemical. If both of you take it, there's nothing wrong. For instance, those who have cancer of the prostate, the men, I usually ask them about the wife. How is your wife's period? They tell me the period has ceased and all that. From there, you can infer into a number of things. And when you try to give them what their husband is taking, they try to get improved. So you can see the correlation between cancer and hormonal imbalance. And at the center of most diseases in the world is hormonal imbalance. And there is no other combination of products or drugs that can have effects on the correction of hormonal imbalance than phytomedicine. And these are the simple reasons why we are able to take care of fibroids, blocked fallopian tube, issues of staphylococcus, E. coli, salmonella, are easily dealt with the phytomedicine without misgivings. In no time, these ailments run away from your system. So phytomedicine has gone a long way in our medical system, and it is high time we develop them. We try to develop them and internationalize them through clinical trials so that the whole world can accept, and then we can also use it to diversify the economy of our great country, Nigeria.